for the introductions. Let me thank first the organizing committee for GIS for accepting my case. Okay, I have nothing to disclose this about this case. This is a 40. Am I this phone? Yeah. This is a 40-year-old woman who has a mitral valve replacement back in 2006 due to severe MR. She presented to the ER with cardiogenic shock. Her past medical history is peripartum cardiomyopathy and endocarditis. Because of that, she received the mitral valve replacement. She's obese and a smoker with history of hypertension, atrial fibrillation, obstructive sleep apnea, and on CPAP. Her medication include warfarin, lisinopril, carvedilol, spironolactone, SGLT2 inhibitor, and furosemide. So she's well treated for congestive heart failure. Her labs, you see, she's in renal failure. Her creatinine is rising up. Her liver enzyme is rising up, and the INR is 4.5, and the lactic acid is 3.5. The transthoracic echo showed the ejection fraction 35, severe right ventricular dysfunction, and aortic regurgitation. But however, there is severe stenosis at the mitral valve. The right heart cath showed the elevated pulmonary artery pressure of 123, and the wedge is 61. This is the first time that I can see this wedge. So this is the turbulence flow at the prosthetic mitral valve, and this is the transesophageal echo showing severe mitral stenosis. And this is 3D, and you see this one leaflet is not moving, and the other leaflet is opening. So this is the leaflet is not moving. And this is the, also, you see that one leaflet is not opening. So, and this is the Doppler showing severe transmitral gradient with a maximum gradient of 30 and the mean gradient of 24. So what's the next step here? Anticoagulation, she's already anticoagulated with INR of 4.5, thrombolytic with that, or redo surgery. With all this comorbidity, I don't think any surgeon will accept taking this. So the plan was to do a transgastric leaflet release. So this is what you see that there is transesophageal echo probe, there is transseptal puncture, and here ICD lead, and you see the mitral prosthesis and the PA catheter, you see that. And we put the sentinel device for cerebral protection from the right radial. So this is the picture, and this is all the explanation. So we put deflectable sheaths across the interatrial septum and move toward the mitral valve prosthesis. And we tried with the tip of a catheter through this sheath to move this leaflet, but we did fail. So we tried with O35 wire just to push this leaflet, and again we did fail. So we tried now with just a coronary wire, O14 wire, to go through this leaflet, and you see the wire was able to cross this fixed leaflet. So we crossed the stuck cusp, and then we dilated that with coronary balloons, step by step, 2, 4, and 5 millimeter non-compliant coronary balloon. And you see now the other leaflet is moving. And you see that on the echo. So this is what we retrieved from the cerebral protection. And this is the echo showing a significant improvement, and the gradient across the mitral valve almost normalized. So this is to take home messages that we can, mechanical valve thrombosis can present with extremis, and still the option is anticoagulation, thrombolysis, and surgery, but consideration for transcatheter manipulation, especially in this unstable patient, or we can use it as a bridge to surgery. Thank you very much.